checking in. We check in every Tuesday afternoon, go over different topics in plastic surgery, and I get to answer your questions. This is Mother's Week for Mother's Day on Sunday, so I decided to do a topic related to moms because a lot of my patients are moms. But really, these three questions are asked really basic. Maybe the first one is directly about moms, but the other two are really everybody's. Everybody will benefit from the answer to the two. So three questions that three things I ask moms before their surgery. So you're a mom, you're thinking about surgery, you think that your body's changed with pregnancy, which we all think that, and it's true, our body's changed with pregnancy and breastfeeding. So I'm thinking about during surgery, and these are the three things that I'm going to focus on to make sure that you are ready for surgery. The first one is, are you done? Are you done having kids? Are you done breastfeeding? Or you want to have more kids? And that's going to definitely alter the procedure I'm going to offer you. If you had one kid, but you're still thinking about maybe having another one, 3, 4, 5, I don't know, whatever it is, then maybe doing a mommy makeover at that time is not the best bet. Not saying that you have to be a mom to have a mommy makeover. No, actually you don't need to. But if you're thinking about having another kid in the next 5 years, then I don't think it's worth going through all the investment that you're going to put in your body, recovery of surgery, risk of surgery, and of course an economical investment in your body to then have another pregnancy and alter those results, right? If, for example, you're a massive weight loss patient, so you're in your 20s and you're like, I don't even have a boyfriend, I don't know when, if, where I'm gonna have kids, then of course do your mommy makeover, which is breast combination with tummy tuck. Improve the shape of your body, feel better about yourself, and then if in 10 years you have babies, then we'll take care of it, right? But if you're a mom but you're thinking of having kids soon, then it's best to wait. I have patients that, for example, have had one kid, but they're like, I just want a little bit of lipo to look better, maybe address some excess fat in the arms and the upper back, and then I know that my belly needs some work, but I'm still not ready for that, then we can talk about other procedures before the kids. But if you're thinking about a mommy makeover, addressing the breast and the tummy, is better to finish, right? Having kids, of course, life happens, and I've had a lot of patients that have had a mommy makeover, and then it's like, I was not expecting this, and I had another baby. And not 100% of the time, the results are gonna be affected, right? I always tell my patients, like, you've had friends, you know of people that have kids, and their bodies bounced back. This can still happen if you had a mommy makeover, but odds are you may need some tweaks and twitching, okay? How long to wait? So it's best to wait at least 6 months after you finish, so your last pregnancy, you deliver your baby, at least a minimum of 6 months. If you can wait closer to a year is best. It is a body transformation, the pregnancy, right? Your body's gonna be stretched out, collapsed, you're still swollen, hormones are gonna be all over the roof. So it's better to wait for that body to kind of go back to our normal state prior to going through surgery, okay? The body took 9 months to make a human being. It's okay to wait 9 months to make sure that everything bounces back and retracts as it should, okay? So a minimum of 6 months to a year. What if you're breastfeeding? If you're breastfeeding, you should wait at least 6 months after finishing breastfeeding. So, example, you had a baby 6 months ago, but you're still breastfeeding. It's better to wait at least 6 months after you finish breastfeeding. So if you decide to breastfeed for a year, then you have to wait a year and 6 months, so 18 months to have your surgery. This is mostly focused for breast procedures, but it is in reality for any procedure. I've had patients that come, for example, for BBL and they're still breastfeeding. Remember that you're going under general anesthesia. There's going to be a lot of medications influx in your system. You're going to have narcotics. You're not going to be able to use that breast milk. You're going to have to pump and dump. You don't want to be leading with pumping and dumping when you're recovering from BBL or liposuction procedure. You don't want to be dealing with the stress and the caloric needs that go into your body, removing you need all those nutrients to heal from surgery, okay? This is not the time for you to be nourishing someone else, okay? So it's better to transition your kid out of your breast milk and then have the surgery. This is in the best interest, not only for breast procedure, but any procedure, because of the metabolic demands of breastfeeding in your body and the metabolic needs that you're gonna have to heal, okay? So around 6 months, that's minimum. So that's the first question. Second question is, do you have help? And when I say this, it's not only for the initial recovery period, but let's talk about the first 2 weeks. The first 2 weeks, everybody's gonna need help, right? You're not gonna be able to move around the house as you normally do. You're gonna need more assistance, even getting up, in and out from bed, maybe into the shower. Especially that first week, you're gonna feel very tired, very short of breath, especially when doing stuff. So you need someone with you that can help you do the day-to-day stuff. Also help you keep up with your walking, keep up with your nutrition, keep up with your hydration, okay? Even closing the faja. So you need someone with you to help you, okay? Those first 2 weeks are the ones that are gonna be more hands-on. By 2 weeks, majority of patients are back to work. They are transitioning back to doing their normal stuff, but there's still some restrictions. And this is where the moms have to listen. 10 pounds max weight lifting for 6 weeks. Majority of babies after 6 months are more than 10 pounds. So that means you can't be lifting your baby for 6 weeks. And that is hard. I had to do it. That is hard. And not only because you want to hold them, you can still hold them, but you have to be sitting down and someone has to give you the baby. So you don't physically lift the baby up, okay? If you're sitting on a chair and someone brings the baby and puts him on top of you, that's fine. But I don't want you lifting up the baby. So what was the hardest for me? And I'm gonna speak on a personal experience. Mornings and nights. Why? The crib, okay? Getting the baby in and out the crib. Okay, so something that most people don't think about, it's like, oh yeah, my husband can help with this and that. But if your husband, for example, went up to work that morning earlier and the baby woke up, then we have to stay here with the baby until someone comes to actually lift him up from the crib, okay? I had the surgery when my baby was 2 years old. So I taught him how to get in and out of the car seat by himself, okay? So when they're a little bit older, you can do that. When they're a little bit younger, it's easier because they don't know, they don't seek you as much as when they're toddlers. So things to consider, right? All of them have risks, not risks, but ups and downs, or benefits or downsides. But the bottom line is you are gonna need help with the baby. And if you are, like we all moms are, the primary provider for the baby, meaning like, in the morning, getting dressed, in the night, bath time, putting him down, you need help for this 6 weeks of someone with you, okay? I have patients that bring moms to their houses to help out, spouses that adjust the times in their works to help, but it just involves a little bit of planning. It's not impossible. A lot of moms get surgery when they have babies or toddlers, like I did. It just involves a little bit of planning. So that's my second question to you. And my third question is, what are your expectations? And this goes to any person undergoing surgery, but specifically for moms because of what I mentioned in the first question, okay? Is your expectation to have just a little bit less thickness and a little bit overall contour improvement, but you don't really want scars, you don't care about a little bit loose skin, then you may be a candidate for liposuction, right? After pregnancy, the skin quality is not the same. We may have some muscle stretching or diastasis, which requires a muscle repair. But I have a lot of patients that have a little bit of a bulge and they're like, I'm fine with that. I just really don't want the tummy tuck scar. I just want an overall contouring of the waist, plus minus some fat transfer. So we can work with something with like liposuction on those patients, but knowing that you will still have some loose skin, especially when bending over, when twisting, doing exercising, wearing something tight on the waist, you will have some loose skin, right? Yeah, on the other hand, if your expectation is that I don't want that loose skin, then the tummy tuck is the best procedure for you, right? getting rid of the excess skin, we contour the waist, we can do fat transfer on the hips at that time if you want to complete that overall hourglass figure, and also the muscle repair part. So those are the three main differences when we're discussing abdominal or body contouring after pregnancy, determining if you're a candidate for liposuction or tummy tuck. Talking about breast procedures is more about the volume, your goal with volume, and the quality of the tissue that's there, okay? And what I mean about volume is with a breast lift without implants, you are gonna lose at least 1 cup size, okay? So if you're okay with less volume without an implant, then you're a candidate for just a breast lift, knowing that you're gonna be smaller. The other one is shape. The implant provides a structure to the breast that the breast tissue, usually after pregnancy, we lose density. The hormones change, breastfeeding changes our parenchyma or the tissue of the breast, and it's not as dense. So when we were younger, before pregnancy, you pull a push-up bra and you were able to achieve that the cleavage because of the density of the breast. That's what provides structure. Even the majority of patients after breastfeeding pregnancy, even with a push-up bra, it's flat. They told me it's flat up here. It's because of that density. And that it's only gonna be provided with the structure of an implant. Even with fat transfer, we can add volume with fat transfer to the breast, but that structure, upper pole fullness, cleavage is really obtained with an implant, okay? And the other one that I mentioned is your goals, right? If you have a lot of loose skin, you lost a lot of the density, and you just want the nipples to be pointing forward and you don't care about anything else, then it's okay to do a breast lift. And I have patients that tell me this, okay? So I don't agree with patients or surgeons that say you need implants. I never say that to a patient because I believe that every person has a goal in their mind. So it all depends on what is your goal, right? So if you tell me that your goal is to have cleavage and roundness and fullness, then yes, you will need an implant. But it all depends on your goal. If you just tell me I just want them pointing forward, I don't care about anything else, then we just need to do a breast lift and you don't need implants. So it's all related to your goals and when we're starting with, okay? So those are the most common 3 questions, and like I mentioned, these 2, they're good for anybody, right? Even if you're not a mom, you still need to bring help and plan for these 2 things, right? And the 2 and 6 weeks, the majority of that are not moms don't have that problem unless you do a work that you need to be lifting stuff. Then you need to plan, okay? So some people, for example, nurses, I do a lot of nurses that have to be moving patients. So if that's the case, you need to address that at work. So you have help from the 2 to 6 week mark that you can work, but you can't be lifting anything heavier than 10 pounds. So this is good not only if you're a mom or not, but depending on your line of work. And this one here, of course, it's just universal in the sense that your goals will determine what procedure is best for you, and that's why the individualized approach to a consultation is so important. Okay, I'll get to some questions now.
Yeah.
Let's go.
Hello, Dr. Vidal. What are the risks of getting she wants to say Motiva, but said Mitova.
Okay.
Mitova implants long term.
So Motiva implants, let me talk a little bit about Motiva implants. So this Motiva is a new company approved in the United States by the FDA as of October of last year. So it's a new company of implants we have available to use here in the United States. It is not a new company globally. So they've been on the market for 14 years. I went to their headquarters in Costa Rica as of a week or 2 ago, and I got to see firsthand their manufacturing. I talked to their engineers, to their chemists, to everybody in the company, a new company, and they've had multiple studies. And to be approved by the FDA, you have to have at least 5 years of follow-up in the United States. So even though they're in the overall market in the United States as of October, they've been used to do the FDA studies with certain surgeons in the United States for at least 5 years, okay? What is the main benefit of Motiva implants? One, they have a different shell or cover of the implant. So the implants have like a cover and the inside. So the cover of the implants, it's a different one. It's called smooth silk, and it's a capsule or a shell that has been shown to have decreased inflammation in our body. So they have less capsular contracture rate. And the other thing is that because they have a 6th generation silicone gel, which is different from the ones that were in the market before, which is a 5th generation silicone gel, the gel is a little bit softer and more similar to breast tissue, which allows the implant to be filled 100%, okay? So with less volume implant, we achieve more projection, which is great because the implant volume overall is gonna affect the weight of the implant, so the weight in our body, okay? So maybe with an implant looking to, like an implant in Motiva that it's 250 is gonna look more projected and more full because the implant itself is 100% filled. And the other thing that is very important with the 100% filled is the rupture rate. So because they don't have folds or rippling because of the 100% filled, the rupture rate is less. Okay, so those are the main 2 benefits overall: less capsular contracture, less rupture rate. So it is a company that was created 14 years ago. So the studies we have are 14 years old and are very safe. Patients that had surgeries to change the implants because they want it to be changed, or they have capsular contracture patients because it's not 0, it's less than that was before, but it's not 0. So there have been a few patients that have had capsular contracture with Motiva implants. Those implants were in very good quality. They were not the gel itself wasn't yellow or changed, it looked intact. So the quality of the implant is very good. So that's what I can say from what I've seen, and that's why I'm offering it and recommending it for my patients, because I think they're a great company, and the innovation side of it is very promising.
I know this patient. She's my friend, and she asked, "Hi, Dr. Vidal. Does the lifting also apply to Lipo 360 and BBL, baby lifting, on weightlifting?"
Yes. It's not as strict as with breast and tummy tucks, but still. So when we add weightlifting with liposuction, there is inflammation that's going to get involved. So you're going to see that the first 6 weeks after liposuction or BBL procedures, even if you eat something a little bit different, you swell up a lot because your tissues are still healing. So the lifting part may just affect the inflammation in your overall body, which may affect the fibrosis and the retraction of the skin. So that's why I want you to be resting and just focusing on healing and not lifting anything. But of course, there's not like a breakage of sutures or healing like with tummy tuck and breast implants.
How do we know if we will have loose skin or not after lipo?
Very good question, and unfortunately not that predictable. There are basically a few things that are going to tell us you have a better chance of not having it. One is your age. With aging, our skin changes, collagen and elastin in our bodies decrease, so the ability of the skin to retract is less, okay? So that's the first one. So if you are a younger patient, we're talking in your 20s, the chances of you having loose skin is less. If you are in your 40s, 50s, the chances of you having loose skin is very high with liposuction, okay? That's the first one. The second one is the quality of your skin. If you're a massive weight loss patient, if you have multiple pregnancies, you have stretch marks, the skin is very thin, frail, usually those patients don't have a lot of skin elasticity. If your skin is very thick, and you have, some patients have a big belly, but the skin looks thick and no stretch marks at all, those patients have better chances of retracting. At the end of the day, we can't tell you 100% you're gonna retract if you don't. I can examine you and tell you from my experience what is my recommendation.
Dr. V, please, could you explain the message? For brachiotomy, it's like a dream team.
Yes.
Brachiotomy, BMI requirements.
Yes, any surgery really. My BMI, max BMI, this is a common question, so I'm gonna write it here, is 33.5. That's the max with any procedure, okay? I do recommend trying to get it lower than 30, okay? When we lower it than 30, the risk of complications are less. And what are we focusing on? Blood clot risk, wound healing, wound adhesion problems, infections, okay? So trying to get it lower than 30 it's ideal, and also your results are gonna be better. But this is the max, 33.5. Okay, awesome, you guys. Thank you so much for joining. I hope this helped address common questions when you're a mom trying to plan for surgery. And I wish everybody has a beautiful Mother's Day weekend. Enjoy with your loved ones, with your families, with your moms, friends, and sleep and have some rest if you can. See you next Tuesday.
Thank you.